Hello and welcome to Coffee with Dr. Carla. I'm Dr. Carla. I have Michaela here with me today, and we're really glad that you're here, that you joined us, and hopefully we can start to talk about some mental health issues and some of the stigmas. And this topic is a doozy. Postpartum depression. I told you right before we went on, I'm going to throw my daughter under the bus. Sorry. But each time she has a child, of course, they ask her to fill out this survey. And each time she says to me, are these people crazy? I'm not telling them the truth. I'm not letting them take my kids away from me. And I just kind of look at her and go, that's not how it works. And she goes, you just don't know. But what's crazy, the crazy part isn't her response, which is sad. The crazy part is, off the top of my head, I could easily think of a couple dozen mothers who have this same exact response. Something's going wrong with how we're dealing with this postpartum depression. We're really not connecting with these moms to help them understand what's going on, right? And I'm curious, from your perspective and from your experiences, both as a mom and as well as a therapist, what have you been noticing around this issue?
I noticed the same, the fear of the kids being taken away. And I also notice how it's not necessarily tended to sometimes. It can get ignored depending on the cultural background of the person and feeling like they're a bad mom if they do have postpartum depression.
So true, yeah.
And yeah, those are the couple things that kind of come to mind. And also, it gets ignored by the medical field
I was
sometimes.
just gonna say, because
And sometimes it just
it's a
gets,
stack of paper. They're like,
yeah,
fill out the birth certificate information, fill out this, fill out this, fill out this,
yes,
and one of 20 pieces of paper is, are you feeling depressed?
exactly. Exactly. And I feel like it doesn't necessarily get followed up on either. Like those are the papers they get as they just pushed out a baby. Like,
Right.
so does that get followed up on? Not necessarily. And then when it does get followed up on, is it because of they need medication and then it gets medically taken care of versus actually tending to it and thinking more about what they're experiencing?
So I have one child and she's 31 and a half. So it's been a long time since I
Mm-hmm.
gave birth. I know I did not fill out one of these surveys,
Mm-hmm.
right? I also know that after she was born, my hormones were going wackadoodle.
Mm-hmm.
And, if someone would have asked some of these questions, of course I feel kind of
Yeah.
off kilter. Yes, I feel like
Mm-hmm.
not doing anything because I'm so overwhelmed. No, I haven't slept in,
Mm-hmm.
a week. Of course these things have
Exactly.
changed, but that's not necessarily postpartum depression. So some of the normal things of just having a baby and having your hormones get all out of whack again and trying to re-regulate all of that stuff,
Mm-hmm.
you know, is normal, right? So how do you see where's that line crossed where it's no longer just like, hey, that's what happens when you give birth
Mm-hmm.
versus now we're talking about real postpartum depression.
Mm-hmm. I feel like the symptoms show up differently for everyone because, like you said, you feel like your hormones were all out of control. I felt the exact opposite. I was very calm after giving birth. I was very relaxed. I felt like it just was what it was. Like that was just the situation it
Right.
was. Um, there were times where I was like, what am I doing? For sure. But I feel like it kind of depends on the person and their experience. Also, their support system, who helps them is a big thing. If you're doing this all alone, that's going to contribute differently than versus if you have your village already set up, which I did gratefully. So maybe that is probably why I was just calm. And it also depends on your child itself and
Sure.
how your child kind of responds to this new life in
Right.
rural.
If they're colicky or they're having a difficult
Yes,
time,
exactly.
maybe eating or sleeping, then of
Hmm.
course that changes everything.
Exactly. And then I also another thought that kind of came up when you said that you didn't receive papers is that this should be something that is kind of thought of as a preventative, where psychoeducation can come into play when the person becomes pregnant, when they're starting their pregnancy and going to doctor's appointments and
having these conversations, right?
yes,
Yeah, as opposed to here's a piece of paper.
after.
Yeah.
After what the postpartum could have already showed up by now, and then they're so afraid that they're going to lose their child that they're not being aware of what's happening, versus if it was in the beginning and if it was thought of as a preventative method, they can be more aware of the symptoms and know how to seek help.
Yeah, and I also have to wonder, I mean, just thinking about my experiences and, the experiences that I've heard about from clients and friends and family and whatnot. Those first couple of days, even, it could be very blissful, right? Like, oh my gosh, I'm so excited. I have this new baby. And then I remember my first week, after my daughter was born, my mom's like, you need to eat. Oh, I just ate. She goes, when? And I'm like, oh. It was probably like 3 days ago, right? And she's like, you need to take a shower. I'm like, I know I just showered. She goes, you smell. You didn't just shower. I'm like, okay, right? Like, so these are little things, but part of it is just like being a new mom, right? So again, is that postpartum? And I think that a lot of these things are typical or not so unusual in the beginning, but I really think where the concern comes in is when, now we're talking about 2 weeks, later, and you're still feeling blue and you're still having a hard time getting things together. And then it's a month later, and I think that's where we really need to be mindful of it, right? So to ask somebody 24 to 48 hours after they gave birth whether they're feeling depressed doesn't necessarily capture anything, right? And oh, how crazy would it be if there was a system for someone to actually call and have a conversation with these people?
Exactly.
Now, I don't know if they would be honest then either, right? Because there's still this fear that your children would be taken away. They will not. You being depressed does not get your children taken away. DCFS does not want your kids because you're depressed. Right? So, but but that's such a strong fear. But still, like, I love your idea of like being preventative, something that's kind of talked about along the way. Talked about, not just
Yes.
pamphlets handed to you.
Exactly.
Right?
And a lot of pamphlets are out there for it, but at the same time, if the person doesn't
Yeah.
exactly understand it, what is the purpose of it?
Right. Or they're still convinced that you're going to take their kid away. They're just
Exactly.
tossing it in the garbage as they walk out.
Yes.
So let's think, what might be one thing that you really want I would say new moms. Let's start with new moms. What's one thing you want new moms to recognize um, in regards to their mental health after giving birth?
One thing that kind of comes to mind, I know that it's hard, is separating yourself from being a mom. I feel like when you realize that separation is kind of easier to recognize different symptoms because you're not in mom mode and you're tending to yourself. And it's important to
Oh
tend to
my
yourself.
goodness. Yeah, and that's so hard for all moms. They're
Yes.
sure that if they tend to themselves, they're somehow
Selfish
neglecting their
and
children.
yes.
Right, yeah,
But you can't pour from an empty cup.
exactly.
So yes, tend to yourself, pay attention to your own needs and not push them to the side.
Okay.
Mm.
And what about that mom who's now, you know, at the 6 month or to a year mark after giving birth and they're still not feeling like themselves? What do you have to say to them?
I think the same still applies. It's kind of finding your groove in yourself, and separating yourself from being a parent and what your life is kind of like now, um, as an individual. So I think the same still kind of arises in separating that and seeking out help when you need it. Don't be afraid to call
Of
your
course,
doctor.
right, yeah.
Don't be afraid to speak up. There, like we said, you will not get your kids taken away. DCFS does not want them. But yes, so tending to that and seeking out help and being honest with your doctor about kind of what you're experiencing.
Yeah. I mean, it might be a hormonal imbalance. It might simply be you need to talk to somebody, right? Um, you mentioned earlier on having this village in place to help you out. Maybe it's reassessing what your support system looks like and what maybe you can change or kind of shore up in order to make it better. So,
Exactly.
all right, thank you so much. So remember, you can change your thoughts, discover your potential, and transform your life by focusing on your overall well-being. Again, put yourself first. Until next time, continue working on being the best you possible. Bye now.